Good afternoon. This is Dr. John Bennett broadcasting from Miami, and we have another in the series of continuing presentations for the topic of brain tumors. Today we have the honor of having Joni Aldrich. She's a well-known cancer advocate, and she has a guest, Julie, who she's going to introduce. So welcome, Joni.
Thank you, John, and thanks for having us to discuss this very important, critical topic today. My wonderful guest today, a co-host with me, is Miss Julie Houston, and we have both had our lives touched by having a very, very close loved one, me particularly 3 different times, Julie with her husband, with a brain illness. And so we're going to talk today about the very important topic of caregiving. So welcome, Julie.
Thank you, Joni.
Glad to have you here. And I know that your caregiving experience changed your life in so many ways, and so did mine. So I think we're going to have a lot of great information today.
I agree. I'm looking forward to sharing it with our audience today.
Well, without further ado, let me go ahead and bring up the, well, actually, I have the presentation right here. So let me downsize this, load this.
I just want to introduce myself. My name is Slaven Gojkovic. I'm a medical student from Croatia, and I have the honor to be here with Dr. Bennett and enjoy our presentation. Thank you.
Well, thank you, Slaven. Okay, so let me see if the screen share works.
Okay.
Okay, start the screen share. Okay.
Yes, you can see your screen. It's okay.
Okay, perfect. Okay, so again, today what Julie and I want to talk about is the caregiver's journey and the importance of awareness, self-care, and advocacy. I am an author, speaker, publisher, and Julie is an MSW, a patient advocate. So we'll talk a little bit more about our background. Everything looking good?
Yes.
Thanks. Okay. So basically, my journey started in 2004 when my husband was diagnosed with late-stage multiple myeloma that eventually went to his brain. And dealing with a terminally ill cancer patient with metastatic brain cancer was one of the most traumatic experiences of my life. So after Gordon passed away, I started documenting our journey and published articles, books, speaking, and international radio programs on iHeartRadio and UK Health Radio, helping others through information related to patient safety, cancer and caregiving experience, connecting through compassion and guidance for the family and friends of a brain cancer patient, which I wrote out of love, and what the book that I needed when my husband was diagnosed with metastatic brain cancer was written with the help of MS and counseling, Nasa Peterson. And it's based on my journey, which included caring for 2 metastatic brain cancer patients, my husband and my mother later after Gordon, and a boyfriend with a benign brain tumor. And that was all in 5 years. So you might say trial by fire. So Julie, you want to tell us a little bit about yourself?
Sure. Thank you, Joni. So my journey to advocacy did start, as Joni mentioned, when my husband was diagnosed with a malignant brain tumor. And what I recognized very early on, actually while he was in surgery, was that technology was my friend. I didn't know anybody else that had been through this experience before. I didn't know how to begin that search for the cutting-edge treatments that might be available to us in our community and beyond. So that search led me to find communities and individuals very much like Joni, resources like what she has also created that could guide that path for me. And where that led was becoming an advocate by developing an additional resource online. I realized that we needed a centralized place for those resources, and it also led me to look very closely at the things that affect individuals when they are diagnosed with cancer. So healthcare became something that I was highly focused on. So I started serving with a few cancer organizations, Lance Armstrong Foundation, the National Patient Advocate Foundation, and also my local coalition groups like the South Carolina Cancer Alliance. in that, I was able to work alongside folks to develop resources, to look at legislation, to look at policies, and that really has become a passion of mine, and I continue to do that today, even in my current role with the South Carolina State Cancer Prevention and Control Program.
Wow. And Julie, you know, it's interesting how close our journeys are, and that's what the next slide is about. You know, I started with a spouse diagnosed with multiple myeloma that metastasized to his brain, and we connected finally with the right cancer treatment facility, but that was not easy. That was not an easy process. And like you said, Julie, and I think this is a point that we need to make today, because hopefully maybe there are caregivers out there that will listen to this broadcast, well, look at this broadcast and listen to it, and maybe we can give them some hope, because we're going to talk in the following slides on what we went through, and it was a very dark time for me, and it was one that I couldn't get over. Gordon went through progressive disease and treatment protocols, including 3 outpatient stem cell transplants. Caregiving demands led to seeking support. Unfortunately, it's very hard for caregivers to get that support, because a lot of times we're in the trenches. Cared for my mother with metastatic brain cancer, and also a boyfriend with a benign brain tumor that went through brain surgery. And my support networks, what I am progressing into is more patient advocacy, patient safety, and getting patients to speak out. Speaking at cancer organization events to inspire caregivers, publishing books, 7 so far, including the most recent, Advocacy Heals You, 15 Keys to Fast Track Results and Emotional Fulfillment, which does include a lot about patient advocacy and personal advocacy, and making connections with advocates and researchers and others affected by cancer, and finally healing through advocacy, which truly has helped me so much. So, Julie, you want to take us down your journey?
Mm-hmm. Well, I mentioned several of these bullet points in our previous slide discussion, and just want to say that, you know, even though we're concentrating today on what really rocked our world and the most devastating diagnosis, it actually was the second diagnosis for my spouse. But both incidences occurred just prior to starting a position that provided insurance coverage. So that became a difficult navigation. And because of programs and other advocates, you know, we were able to get through those kind of hurdles. So I think that is really what turned my attention to looking at what could we do to make sure that people had access and that their health insurance wasn't at risk once they had this cancer diagnosis, that they could focus on the healing. And then for caregivers, just like you mentioned, Joni, you know, we do become the gatekeepers and the individuals on the front line, and so many times you really are focused on what do I need to do next, and certainly with a brain tumor diagnosis, they're given a short prognosis often, and so you do feel very much starved for information, you feel hopeless, and you do feel very, very responsible for guiding your loved one. So I think the importance is knowing how you can connect with others, how you can work alongside those that have been in this journey, either as a researcher, as an advocate, as a fundraiser, as a policymaker, and it certainly did transform things for me as well. I think it was something that I felt like I could contribute to, and I could make a difference for others, and of course it certainly did result in long-term survivorship for my spouse. So, you know, we finally did succeed in raising awareness to the point that we had Brain Tumor Awareness Month in May. That was a great time. I enjoyed creating the Go Gray in May campaign and kicking that off here in my area, and that awareness has allowed others to find a channel to tap into and a way to contribute, and an additional support network, at least here in the state of South Carolina, that connects them nationally and internationally.
And one thing I think is important, Julie, and by the way, you mentioned your healing through advocacy, which you've developed amazingly to me, and I have to say, you know, I'm so proud of what you've accomplished, because a lot of people might put their head in the sand, but advocacy means coming out there and trying to help others. And so earlier I said, I hope that this broadcast will give caregivers of a brain illness of any kind some hope, some additional hope, which is what I hope to do with my book, what you hope to do with your papers, and what we hope to do through all our advocacy. But I also hope that if there are researchers out there and neurosurgeons and oncologists, please make sure that you understand what that caregiver is going through. So I hope that today we can inform many about different viewpoints and open up many viewpoints. So by the way, Julie, sorry I got a little quick on the trigger there before, but you covered them all. Okay, so now we're going to talk a little bit more about awareness defined, and some of the things that certainly came out for me going through this caregiving journey, and also for you, Julie. And these are some amazing points that they may not look like big points on the screen, but they are. When a person receives a cancer diagnosis, and even more specifically, a late-stage cancer diagnosis or a brain cancer diagnosis, our lives have changed. Both the caregiver, the patient, the family, everybody's lives have changed from that point, especially when it's a brain illness. And they'll never be the same. So one of the hardest things to do is learning the language to communicate with researchers that comes through greater awareness of the disease. Many times we're in the trenches too, trying to save our loved ones, trying to help find the right treatment, trying to find the right protocol. Mm. Brain cancer, its treatments and the stressors of it are many times unknown even today, even though, Julie, I know there's a slide later on that you're going to discuss the different parts of the brain and what it can cause. But no roadmap exists for caregivers for those affected with brain cancer, which was the hardest thing for me, although I will say, Connecting Through Compassion, my book, is the best thing that I've ever found. And it's used at Duke Cancer Institute in the Resource Center, used frequently, and they do a lot of brain cancer and brain tumors. Raising awareness becomes the lifeline for caregivers who need to turn adversity into action, and each individual who finds themselves on this path has a contribution as an advocate in search of healing. Many advocates find that they can turn the attention away from their self and away from the difficulties that they're having, and they find themselves healed. So I wanted to talk, and I'm sure that there are many physicians out there and researchers, neurosurgeons that are aware of this, but there was one particular point that I wanted to bring up here. Incidence of worldwide cancer, brain cancer, metastatic brain cancer, and non-malignant tumors. I think we have a pretty good hold on the worldwide incidence rate of all primary, malignant, and non-malignant brain and CNS tumors, which is a total of 356, roughly 360,000 per year. What I don't think we have a good number on, and of course, having a husband that died from metastatic brain cancer, his number went down as multiple myeloma. His number did not go down as brain mets. So I was really surprised to find a percentage out there, and I put on here the Cancer Network. Brain mets, secondary brain cancers occur in approximately 15% of cancer patients as a result of dissemination of systemic disease, cancer and disease, which if you were to relate that, if that is a true percentage, 14.1 million worldwide cases in 2015, that would mean 2,115,000 new cases of metastatic brain cancer. Now, with my mother, it was a matter of treating one lesion. With my husband, within 4 months of a brain CT scan where he showed no evidence of brain cancer, he literally had cancer all over his brain. So that can range from minor symptoms to major symptoms, but this is a problem. They need support. As a caregiver, one of the things that I want to talk about is our first thought when we hear something from a loved one may be, wow, that's kind of odd. And that's really what I thought. And this is some information from my book, Advocacy Heals You. After 2 years as Gordon's cancer caregiver and 20 as his wife, I noticed there were things that left me thinking, what? And there were some scary motor vehicle incidents, including one with my 40-foot motorhome. When I looked up and at 75 miles an hour, we were headed to a tree. Thankfully, that didn't end as badly as it sounds, but brain illness patients often know that something is wrong, but the brain's primary survival function is to hide it and deny it. So therefore, a morning appointment with Gordon's radiation oncologist the day after he collapsed for no apparent reason at the cancer center was pretty tense because I kept saying, there's something seriously wrong with Gordon. And the oncologist was kind of on the fence. Gordon was sitting there saying, no, everything's absolutely fine with me. And so finally he needed to step out of the room to go to the restroom, and I looked at the oncologist, and I'll be the first to tell you, I broke down. And I said, you have got to do something. And once those floodgates opened, it was pretty amazing.
You know, Joni, I was just going to say, these things can change before your eyes, subtly or very suddenly. And, in the caregiver role, it's just really, really helpful to understand that at least journaling about this will allow you to have a further understanding of what your loved one's going through, and also to further develop that language that you need to work alongside with their physicians and specialists. It also can help in being able to make sure that you're assuring the health and safety for yourself, for your family, and to get the right support in place for yourself and for your loved one.
Absolutely, Julie. It's so important. But what I wanted to do by bringing that up was I'd like to open a conversation that I would like to actually see oncologists when a patient is diagnosed late stage. I'd like to see them have an honest conversation right off the bat with the patient and caregiver, not scaring them. There are treatments for metastatic brain cancer now. Stereotactic radiation was what treated my mom, and it was easy to fix. But have a conversation with the patient and caregiver. This is what I wish had happened with Gordon and I, because I know it was in his central nervous system. And it wasn't a stretch to think that at some point in time it might go to his brain. But no, not one single oncologist had a discussion with us, Julie, on this could actually become this particular, especially when it's lung and breast cancer, there is a possibility that this could go to the brain, and this is what, as a caregiver, you should be looking out for so that you can let us know if you see anything as soon as possible, that you're seeing something that's kind of is worrying you a little. And yes, you're absolutely right. Keep a journal. That's very, very important. But
you all become a member of the caring team. Right. You're all advocates at that point. And so, yes, I agree with you.
But also the point that I wanted here was we as caregivers don't need to feel invisible. And I think that's much better than it used to be, because I know when I was caregiving for Gordon, I kind of felt like I was in the background. The doctor's primary focus is, as always, the patient. And I understand that, especially with a 15-minute appointment with a specialist. So, but we really, really have to start honing in on the caregiver as well and hear them when they say something is wrong. If Gordon had not left the room that day, I don't know what may have happened, but I can tell you his mind, when it unlocked, he went from what appeared to be a fairly lucid man to minute hallucinations. It was shocking. So, actually, Julie, would you mind going through the symptoms of a brain tumor?
Sure. So, you know, one of the things that I did want to mention with what you were talking about and journaling was, you know, that there are some good tools out there that can kind of guide you along the way. And it's kind of becomes your repository of resources and information, very much like what we're getting ready to talk about here. And when I started working with the Livestrong group, you know, they have a guidebook that they provide to cancer survivors that, you know, became a really invaluable tool for me, because it really kind of walked me through the process of being able to talk to physicians, understanding kind of what to pull together, how to document things, how to journal, and then it was in a centralized place. And I know that when you're going through this really difficult journey, kind of organizing yourself and those things, and then sometimes you even meet somebody in the waiting room, you know, that you connect with, and you realize you didn't exchange information, or you lost the information or the card. So I found that to be a really valuable tool. And so in the resource that you're showing our audience here today, you know, I recognize that these symptoms alone don't really indicate necessarily that there's something neurologically wrong with you, and certainly doesn't confirm that you have a brain tumor, you should be concerned. But I know from my experience that many of these things had presented, and you just didn't have anyone that thought that a certain type of test needed to be done. So the symptoms, of course, you know, are if you're having vomiting that you can't really seem to associate for any other cause, you know, mood swings, cognitive decline, hearing problems, headache, speech problems, seizures. So many times brain tumors are discovered because there's an accident and somebody ends up getting an MRI or a CT scan to assess, you know, if there has been some kind of injury to the brain. But oftentimes, you know, folks find out when the tumor's grown to a certain size and it becomes a grand mal seizure. So, you know, when I was talking about some of the resources, you know, if you're seeing these kind of things in yourself and others, I think one thing that I've learned, you know, that it's an old technique. You should keep a calendar of things that happen. There could be all kinds of reasons that you have certain symptoms, even though our topic today is talking about our experience with a loved one and who was affected by a brain tumor. Sometimes just by going through that exercise, you can look back, you can have the discussion with your primary care physician, with your specialist, your neuro-oncologist about it, and it can be a way to inform and make sure that you're looking at things the way that you need to look at them. The next slide that you're getting ready to share is a tool that you know, I had picked up in some conference that I had attended for caregivers. I don't think that particular tool I ever found again. I actually had featured it on my website, but it just became an invaluable tool because in understanding people's journeys and understanding our own journey, I could use it to communicate what I was seeing, what my concerns were, what part of the brain was affected by the tumor location. And I just can't stress enough, when you find some resources, some kind of a tool that allows you to communicate and to express what it is that you're dealing with as a caregiver, what you're seeing or observing in someone, and also seeking further understanding regarding clinical trials or treatments. These kind of infographics can be very, very powerful and very, very helpful.
Absolutely. And of course, Julie, my husband had, he couldn't walk. I mean, it was fairly quick after he had a little bit of full brain radiation. He had a seizure and he couldn't walk. So some of these are life-changing, just like we talked about earlier. So I think this is a tremendous graphic. Thank you for sharing it. I wish I'd had it when I had Connecting Through Compassion, although there was some of that in there. So, a couple of things speaking about connecting through compassion. Caregiving for a brain illness patient is very complicated. You know, oftentimes I think when we leave a practitioner's office, they think, well, you know, we're okay. You know, we looked at that caregiver and they were okay. But what they're going through on a day-to-day basis can be very difficult. And when I was writing Connecting Through Compassion, I found this distress call, and I found it posted on care pages. Are there any care page members out there doing caregiving for cancer victims with right frontal lobe tumors? Besides the obvious cancer issues, there's a lot of coping due to personality changes. I married my soulmate 32 years ago, but the past almost 4 years I have been taking care of a very different person. We fight the cancer, we fight each other. I have problems being the long-suffering wife when I am also grieving the loss of the man I married. Anyone else dealing with these issues? How are you doing it? The honest truth is, for me, and now I'm getting to me, the honest truth is there was a huge amount of emotional damage done to our marriage from the moment that Gordon was diagnosed with brain cancer, for both Gordon and for me. So it's very complex. Faced with an environment of change, and this is with any brain illness, and I learned so very much from Nasa Peterson when we were writing Connecting Through Compassion. But as humans, the way that I began to think about the difference is we tend to look at things as black and white. We learn to form expectations. We work within social norms. But when someone you love has brain cancer or brain tumor or whatever, brain illness, there may not be any more black and white, but that doesn't mean that you can't find other colors. So now that you're faced with it, no one can predict what's going to happen, and it can be an ever-changing world. It can be changing on a daily basis. And one of the voluntary comments of a caregiver, we had about 8 or 10 other caregivers that gave us information and gave us their insights from caregiving for a brain cancer patient. One of them was being 5 steps behind was the biggest frustration.
Mm-hmm. You know, Joni, I can't emphasize enough really how important it is once you are in this role of being a caregiver to really try and find a support network. You know, there's some resources at the end of our presentation that I've shared that really were very helpful to me. But, you know, being able to reach out in those very dark times and be able to maintain a sense of calm because someone understands your journey, or they might have something that is very effective for where you are at that particular point dealing with a particular issue. It's just so very, very important. And you find the method that works best for you. I mean, there's going to be times where, you know, just simply participating in an online forum is more what you need versus a phone call to a social worker at your brain cancer treatment center, versus getting together in in-person networks. You know, if there's a conference, if there's something there where folks are coming together. Sometimes these support groups are not just in clinical settings, but like the group that I facilitated in my own town, you know, we did it at a church. So one thing to also understand, you know, and I know that other caregivers are not always close to the brain tumor center that they're being treated. Their whole lives have been upheaved because, you know, with the complexity of brain tumors being 120 different types and different clinical trials available, they may be traveling. They may be traveling and staying away from their home. They may be trying to balance that with the fact that they have children in the home. You know, loss of income has occurred, not only for the individual going through the treatment, but now the individual that is the caregiver. That in it of itself brings an enormous amount of concern. And then the fatigue that a caregiver, you know, experiences trying to balance all of these things and figure out how to be effective in letting people assist, figuring out how to extract the resources from networks, and more importantly, in the balance of that, and we always hear this, and it's a big thing in social work too, self-care, and we'll talk a little bit more about that. You're thinking so much about what you're dealing with, and the stress overload usually encourages behaviors that you are overcome by. You lose sleep, your nutrition suffers, you're not able to really feel like you can give yourself permission to check out and get some time to really recharge your batteries, or understand how to delegate some things so that people can take some of that off of you and give you some respite. So I just want to say that connecting with others does give you a safe outlet for your voice, because it is frustrating, it is unpredictable, as you've noted. These things become very personal in nature, but you still want to understand how to develop a coping strategy that gets you through to the next stage. One of the things that I learned, which you take for granted, is what your environment is like. So, we had small children, we had pets, we had gotten accustomed to having a television on all the time. But sometimes when you're undergoing treatment for a brain tumor or brain cancer, these kind of things cause distraction. They can cause irritability. It's too much. It's too overwhelming. So you have to look at your environment and see if maybe some changes need to occur that might actually assist in making those frustrating moments or difficulties to communicate, or whatever may be just a little bit too much of an overload for somebody who's dealing with this kind of a treatment path. You can't expect to be clairvoyant about these things, but I think you can look at your environment and find out how you can minimize some of that noise, some of the things that may be affecting your loved one.
Yeah, one of the ones that surprised me the most was TV, and not allowing the patient or turning the TV onto violent programs, because they may not be able to relate the fact that that's on television. So, there's so much involved in it that Nasa Peterson actually taught me so much. But, making safety the first concern. Again, Gordon can walk. So, but if the patient can, you certainly want to make sure that, if they're not walking very well, they have a safe environment. Take away all rugs that they may get tripped up on. So, there's lots of finite details there.
Right.
And finally, using effective listening. NASA taught me that when a patient communicates or acts out, there's usually a specific need that they want to have filled, and sometimes they can't articulate that. So, so they can act out, or they can relay that in some other kind of behavior. So, what she taught me was start by trying to understand and taking time to kind of stop, and now isn't the time. I mean, sometimes they can say something off the wall and you just don't know how to deal with it. Listen completely, because it's not going to be, they're not going to be able to tell you directly. So you've got to become Sherlock Holmes and find out what the clues are. Validate, say, is this what you need? Or is this what you feel would help you today? Center yourself, kind of clear your mind, especially your emotions, because unfortunately, again, sometimes your emotions can be off the wall. You got to watch those knee-jerk reactions, and then decide. Ask a question to clarify. Deliver the answer, and if that doesn't work, try a different tact. And literally, that's a lot of what you're doing in the process of caregiving. And then reassure. Always try to reassure.
That's so true, Joni. And, again, sometimes you can't fully process exactly maybe what that interaction is like, but you can certainly make a note to yourself and you can revisit it. And I think, as caregivers, we just learn through trial and error, and figure out what it is that we can do and how we can adjust.
So Julie, I know that you're going to talk about turning adversity into action.
Sure. So, just like I said, you learn through trial and error, and you become a gatekeeper, really, for your household. And, trying to balance what was normal pre-diagnosis versus dealing with all of the things that you face post-diagnosis becomes very challenging. And so, certainly, with what we were dealing with loss of not only one income, but also two. I owned my own business, so that had to close so that I could assume the role and looking for the right kind of treatment. You're given a 6-month diagnosis, you've really got to accelerate your effort. But at the same time, it was dealing with loss of insurance and then access to good health care and navigating to a brain tumor center across state lines, communications, your credit could be at risk, dealing with your taxes, if your loved one was dealing with the taxes, and now those roles are changing, and it's something that you have to assume. Then if you have small children, which we did, it's parenting and safety, and then, of course, how do you manage self-care for yourself? So, my process kind of went like this. I was the only healthy adult at the time that could run the household and parent the children and advocate for us. It did become extremely challenging, and I did really suffer physically. Ended up with a diagnosis of fibromyalgia, which led to being disabled myself. Like I said, losing a career and then losing, what your normal was through a cancer diagnosis is extraordinarily difficult, and just really, you don't know how to navigate. You have to learn. You have to get support. So our new normal was, where the disability income of my spouse was the one that assured our quality of life. So, he is a long-term survivor, which is just great. But we knew that things were not going to be the same for our family, and I've been successful in various ways as an advocate. That did result in policy changes and did result on local, state, national, international levels, and a resource project that I was committed to try and provide. I mentioned earlier the Live Strong guidebook. Was something that the Lance Armstrong Foundation got into the hands of cancer survivors, and I saw that as a really critical tool, that if I at least could do this one effort in the state of South Carolina and disseminate it along with materials from the Brain Tumor Coalition that was in existence at the time, and the National Brain Tumor Foundation, the National Brain Tumor Society, the American Brain Tumor Association, and we could raise the awareness about what was going on and give people a way to advocate for their situation, we would see some change, and hopefully it meant that we were heard for increases in funding for research, because we knew through that we could see more long-term survivors. At that particular time, I'm not the only one that was affected by the 2008 house bubble that burst, but the economy was depressed, and since I had closed my business and I had done all this advocacy work, I realized that I had to get a start again so that I could support my family and avoid homelessness, because there was no degree really that I had since being in school. I didn't finish my undergraduate degree because I decided to go into business. So I went back and I finished my undergraduate degree. I pursued my master's in social work, which, interestingly enough, I didn't realize really is all about advocacy. So, it's amazing when you can stay focused and you try your best to navigate, and you have a support system. You can take note, and you hopefully will find a path that makes sense to you. And I realized with the grit, as I call it, that it took to save my spouse's life, that it allowed me to save my own. I no longer am disabled. I no longer have pain. I no longer have the fibromyalgia. I was able to secure a future, and we realized, a different life, a new life. So, my prayers were certainly answered in the fact that this journey and being alongside advocates and understanding how to make a difference, gets you through and allows you to engage in conversations that really can help others have a greater impact. You know, what you see on the screen right now, I was just very, very interested in what kind of caregiver intervention programs were out there for people in this situation, not just with brain tumors, but maybe brain injury. You know, we had the war going on, so I realized that we had a lot of military families that were affected by this. There are other disorders and diseases that put families in the same situation. So, you know, I did a literature review to kind of look at what was out there. And, you know, at that particular point in time, which was in 2011, you know, there were not a lot of caregiver intervention programs. Now, I know that there have been a lot more since. But what I learned from this gave me a new path and a new focus, which is still very much close to my heart today. There were limited studies of caregiver intervention programs for individuals with cognitive impairments. You know, the studies looked at caregivers that were female, and their needs were very different than their male counterparts. You know, caregivers of individuals that are affected with a brain injury, disorder, or disease, they report unique stressors associated with their roles that you might not find in another caregiving capacity. So I learned from this that researchers identified that there certainly was a need for individualized assessment and interventions, as opposed to these fixed intervention programs that relieve caregiver burden and try to improve and address the quality of life for caregivers. So a program, I think, that offers these individualized assessments and interventions, of course, must be affordable and accessible to be really effective, but also has to be timed appropriately in order to measure overall success. And what I mean by that is, certainly, Joni, you know with your journey, I know with my journey, what worked in month 6 isn't what we needed to focus on in month 10. And those ongoing conversations with the social workers at your brain tumor center or cancer center, you know, were very vital, because they were able to understand kind of where you were in this process and maybe how to help you guide or identify additional resources that just allowed you to keep moving forward, you know, and trying to balance your new normal. So I certainly am an advocate for longitudinal studies of caregiver intervention programs to understand what their model of care is, the improvement of caregiver self-efficacy, you know, its effects on caregiver burden. That's how we're going to be able to provide more resources that really work in this particular type setting for sure. And, you know, as we're going to learn, and you're going to see, you know, in a slide after this, you know, caregiving is a significant public health issue that social workers are able to address through individual needs assessments rather than just one type of social support. So, you know, you have to adapt as a caregiver to the care receiver's cognitive impairments, behavioral problems, and activities of daily living deficiencies. So I will say, on behalf of my profession, you know, this is where we're most helpful. So, you know, when you understand the caregiver experience, you know, you report that you adapt to this role, and you adapt by prioritizing the care needs of the care recipient, but often you're setting aside your own needs, and it is hard to focus on that. So I do know that sometimes you just get so very fatigued, and your resources, you know, are really tapped. But you do need to try and make sure that you're continuing a dialogue of your own with your own primary care physician, so that you are applying self-care, and that you're able to be there for yourself, for your loved one, and for your family, because you really are that gatekeeper. You know, researchers associate decreased caregiver competence with the increase of depression. Sometimes it's debilitating physical symptoms or the emotional toll that the caregiving actually exacts. So improving the competence through an intervention program really demonstrated statistically significant improvement in self-perceived competence. So, you know, in being able to be assured about what you're going through, being able to recharge your batteries, understanding that what you're doing is moving progressively through these processes, and identifying and working alongside your care team really is very helpful. So again, as I say, it's just so very important to find that kind of social support and that support network. And there's so many great organizations out there to help. So I've already spoken here about this last bullet point. You know, there are people that are have very different experiences. You know, we come to this experience caring for someone with a brain illness, brain injury, or even a brain tumor, but we come from different backgrounds, different languages. That also can be a challenge. So again, it's important to find the right support network. Reach out to a social worker, you know, at your treatment center, and ask them to help navigate you. And this slide here, I just wanted to share a few tips. I know that everyone that's diagnosed with cancer certainly understands it's a financially devastating disease, whether you're insured or you're uninsured. And we all know that that's kind of what provides the stability for you while you're dealing with so much more. And it's not really uncommon as a caregiver to be very focused on the finances, trying to negotiate or deal with the creditors. And the one tip that I will say is that, you know, if you can get a system where you only focus on that particular task of your role for a certain period of time, you know, employ something like faxes and emails and electronic communications versus getting on the phone hoping that something is going to get resolved a lot quicker, then you might reserve some of your emotional energy for the more important tasks that you need to take care of, and it will allow you to hold on to the recharge that you've been able to give yourself from day to day or week to week. So you're committed to a role that's really demanding, but it's critically important that you arrange time for yourself and work with your family or those around you to try and get some of that respite care, because you don't know what the journey is going to bring. You don't know how long the journey is going to be. And again, you know, we've seen an increase in long-term survivorship, so it is important to focus on the now. Forgive yourself, realize you're not superhuman, and it's a process, and the unknowns can't be controlled. They can just simply be managed. So do limit that time you spend on those unpleasant tasks and try and unload what you can by journaling. Journal your experience. You may be on a path, you know, that'll inspire others, might impact policy or additional and future research, or influence others like Joni and I have done on our path.
And thank you for all of that, Julie. Those are great tips, and for all of the great information. And I want to just, in layman's terms, say a lot of your research has been on the fact that there aren't enough numbers and there aren't enough understandings of what caregivers are going through, even though we have millions and millions of them around the world today. And I added this slide because I absolutely admire the Rosalind Carter Institute for Caregiving so much and what Rosalind Carter has done. It's at the Georgia Southwestern State University. Well, actually, they have several other locations, including Korea. And I just absolutely love what they do, and I know we're kind of short on time, so I'm kind of moving ahead here.
Well, Joni, can I just, I know we're down to our last slides, but I want you to go back to that last slide just for a second. Okay. Because I would like to put in context the fact that for whatever reason, you know, this was something close to Rosalind Carter's heart. And our audience today probably is acutely aware that, you know, former President Carter, Jimmy Carter, her husband, you know, recently revealed to the world that he was dealing with a cancer diagnosis. And that cancer diagnosis actually involved metastatic brain cancer, or had metastasized to the brain. And yet, you know, his treatments were successful. So the reason I asked you to go back is because this was something close to her heart, but because of her work and the foundation that she had laid, she was better equipped for her spouse at the time that this became their journey. Right. And I just think it's really important, you know, that we recognize the talents that we have in ourselves and that we understand that we have something we can contribute, because I do think that that really is advocacy through healing.
And actually, part of what Rosalind Carter has done, she has foundations for mentally ill patients as well. So obviously having mental issues closely relate A lot of the presentation today was from my books, my two books, Advocacy Heals You and Connecting Through Compassion. Again, Connecting Through Compassion is a book that's used as reference quite often, a lot, at Duke Cancer Institute in the Resource Center. And also, Julie added these wonderful additional resources. I'll add one more to this, and that is Imerman Angels, I-M-E-R-M-A-N, Angels. I should have mentioned that earlier. They have wonderful, not only cancer patient support, but caregivers.
Yes, fabulous. Thank you.
Diagnosis. So, Livestrong, National Brain Tumor Society Patient Advocacy Foundation, National Patient Advocate Foundation, Rosalind Carter Institute, and Family Caregiving Alliance. And wow, Julie, we made it. I tell you.
So, Joni, I just really want.
Uh-oh. Are you there?
The fact that your books are published, the fact that they've been able to get into the hands of individuals, the fact that they are, so the formats that you've put forth are so helpful for someone who is really in a dark place, dealing with a new role, dealing with an awful lot of challenges, but so easy to read. It does come from a great layman perspective, amount of passion. And I want to thank.
Okay. I'm not hearing anything, so I don't know, Julie, if you broke up or what. Slaven, did you have anything? John, did you have anything? And hello,
No,
Eric.
no, thank you. I'm sorry about the technical difficulties. It's not your fault.
Oh, okay.
And I'd like to thank you for bringing another part. I'm so tired of hearing doctors talk about it.
Uh-oh, and here's Dr.
But I'm looking forward to hearing Erin talk, and I'd like to thank you for introducing me to Erin, because we've talked to neurosurgeons, but to no oncologists. And just like we're getting a complete picture with the patient side, we're going to get a picture from the oncologist side. And I'd like to thank you for introducing me.
By the way, you're getting it from a great one.
Yeah.
So, Erin, take it away.
Okay.
So good to see you.
Thank you.
All right. Thank you, guys.
Thank you very much. Thank you very much. It was.
Thank you, Slaven. Okay.